Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Many people who have been hospitalized with a COVID-19 infection are suffering from long-term persistent symptoms. These are called long COVID. They used to be called long haulers. Now it's called long COVID. A recent study from Italy shows that they suffer with changes to cognitive functions, brain functions, including brain fatigue, trouble with the attention span, issues with solving problems, inability to plan things out, memory loss, even depression, even post-traumatic stress disorder. Now, these often occur within 2 months of being discharged from the hospital, according to this research, and are still persistent many months later, even 10 months after discharge. So time will tell how permanent these symptoms are or not. So what can you do? Well, I hope to give some good advice over the course of this episode. So welcome to my episode, Long COVID and Brain Function. My name is Jerry Hickey. I'm a nutritional pharmacist. I'm also the senior scientific officer over here at Invite Health. I want to thank you for tuning into today's Invite Health podcast. You can find all of our episodes. There's hundreds of them for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Please make sure you subscribe and please leave us a review. You can follow us on Facebook, Twitter, and Instagram at Invite Health. The information on this episode, by the way, is linked at the episode description, so let's get moving on this. Important stuff here. Previous research indicated that about 30% of COVID survivors have long-lasting, does that mean permanent cognitive issues? And 30 to 40% have psychopathological issues such as depression or anxiety. Now, these issues have been connected with the worst phase of the infection when respiratory tract symptoms are dominant. So the doctors are wondering if there's a period of reduced oxygen supply to the brain that is at least partially responsible for the neurological deficits. You know, I was hoping that by this time we would no longer be discussing COVID-19. But I have to tell you, 2, 3, 4 months ago, a lot of people were contacting me with my views on the immunizations for COVID. I gave them my honest views. But now I'm getting, over the past several months, I'm getting a number of people who are these long COVID patients. I'm getting a lot of people who have headaches, depression, anxiety, confusion, even dizziness. So I'm getting people with all sorts of persistent symptoms that developed after their infection. Like I've had a number of people who've contacted me with digestive tract issues, such as persistent diarrhea, and other people, very few, but several people who've developed GERD, a very painful GERD after they had their infection with COVID. And the 3 people that contacted me with GERD all had intestinal symptoms when they had COVID. They all had severe diarrhea when they had the COVID-19 infection, so maybe there is a connection there. GERD is gastroesophageal reflux disease, where your stomach contents are refluxing up into your mouth and throat, and it's not a pleasant thing, but these people told me it was actually painful. So there's also a connection between white matter hyperintensities and memory issues, according to these Italian researchers. By the way, the research is from the Division of Neuroscience, San Raffaele Scientific Institute in Milan. So white matter hyperintensities they do a brain scan, like a functional MRI, and there's pockets of damage showing up in the white matter. That's white matter hyperintensity. So that's really important. Gray matter is where the memory takes place. It's about 10% of your brain, but it doesn't work without the white matter, which is half your brain. The white matter is where the myelin sheets cover the nerves, a fast transmission of information from the body and out from the brain. Damage tends to grow and spread through the white matter. So that's an important connection that they made with memory issues and white matter hyperintensities. This is the kind of damage you see in like people who played a lot of football. They played football in high school and college and then the NFL pros, or people who played a lot of soccer and hit the ball with their head, or boxers. They get white matter hyperintensities. And they eventually develop chronic traumatic encephalopathy, where it just ruins their brain. It seems that damage can grow and spread through the white matter. So this finding is particularly troubling to me. But we'll get into all this. We'll get into what are some things we can use on my end of the pond that could be helpful for the brain of people who are long COVID sufferers. But here's something scary interesting. A lot of things in science are scary interesting. It was the same period where the report came out from Italy showing that people were developing all these brain, memory, and neurological symptoms and problems after being released from the hospital. After several months after discharge, it was showing up in a number of people. But in that same period, there was a report of people who had autopsies performed on their brains. These people all died of COVID-19. And it was published in the journal Nature. And it's researchers at Stanford University over in Palo Alto, California, one of the best academic research institutions on planet Earth. So one of the major study authors, I hope I pronounce his name properly, Tony Weiss-Corey, he's a professor in neurology at Stanford University. Here's what he compared the damage seen in the brains of the people who died from COVID-19. He compared it to the damage seen in the brains of people who died from Alzheimer's disease and Parkinson's disease. There was that much trauma in their brain, that much damage in the brain. He states that these people with COVID-19 sometimes didn't have outward signs of neurological impairment, according to a report in Medical Express. So Weiss-Corey notes that about a third of hospitalized COVID-19 patients report neurological symptoms, such as here's his statement: fuzzy thinking, forgetfulness, difficulty concentrating, and depression. These problems can persist as a part of what's called long COVID after the infection is cleared from the body. So scientists are disagreeing. It's a point of contention. Did the virus actually enter the brain? It doesn't seem to be. They're not seeing evidence that the virus entered the brain and destroyed the brain. It seems that the virus is triggering inflammation in the body, that inflammation is spreading into the brain, and this is causing the damage and the symptoms, the persistent symptoms. So I've had a number of clients contact me with all sorts of problems after COVID-19. I had a couple of people contact me who never had a blood sugar problem in their life, and after COVID-19, they were diagnosed with diabetes several months later. And these are people like who eat right and they exercise, and I mean, they're not obese. You know, it's not something you would expect. So here's what I'm telling them for the brain issues. Now, I do check with these people what medication are they put on. I want to make sure that there's no interaction with the supplements I give. And I also recommend that they discuss these with the managing physician. So there's a formula, biocurcumin 5-loxin. It was designed for joint pain and back pain and even nerve pain. But it's great for the brain. 5-loxin is from the frankincense plant, Boswellia serrata, and it's the best of the best ingredient from that plant. It's been shown to reduce inflammation in the human brain. Biocurcumin is a well-absorbed version of the herb turmeric. You know, a lot of people call it curcumin, but curcumin is just a small part of the plant. There's like 150 ingredients in this plant, and curcumin is only like 3 to 5% of those ingredients. So there's a lot of other major ingredients in there that are every bit as important as curcumin, including bismuth, oxycurcumin, and aromatic turmerone. So biocurcumin has all these ingredients. It's loaded with them. It's mostly these ingredients, but it's really well absorbed because regular turmeric is very poorly absorbed. But there's been many brain studies using biocurcumin. There's at least 5 studies in adults with depression, major depressive disorder, and atypical depression, where they gave biocurcumin either alone or along with antidepressant drugs, and it really helped people with these forms of depression. Because depression isn't just like a wall missing a brick, and you give an antidepressant and it fills in that brick. There's damage to the entire terrain of the brain. There's inflammation affecting the entire terrain. So if you can clear up the inflammation in the brain, it makes it easier to treat the depression. So in one study in people with major depressive disorder, giving biocurcumin to them improved depression in a large percentage of the people with major depressive disorder. Fluoxetine, a prescription drug, was a little bit better, but when you added the two together, the fluoxetine plus the biocurcumin, it was a real winner, because a lot of times there's a failure to improve the depression in people with major depressive disorder, but when you added the biocurcumin to the fluoxetine, it was dramatic. Almost all of the clients, their depression was improving, and the biocurcumin's really safe. There's studies out of Edith Cowan University in Australia. Turmeric, if you could get it into the brain, helps to break up the plaque seen in Alzheimer's disease. So there's studies showing that fish oils, green tea, and turmeric all help break down the plaque that you see in the brain of Alzheimer's disease patients. So they've been studying our biocurcumin over in Australia to see if it helps Alzheimer's patients. But there's also a number of studies showing that it improves memory, like you give somebody biocurcumin or a well-absorbed turmeric with their breakfast, and it seems that their memory improves over the next 3 to 7 hours. So there's a great deal of evidence about curcumin in the brain. The other beautiful, turmeric in the brain, curcumin's only one of the ingredients. The other thing about turmeric, it's been proven to restore levels of brain-derived neurotrophic factor. Young people, when they go to sleep and they go into deep sleep, non-REM sleep, it's called delta wave sleep, they release a lot of this healing factor in their brain, and it creates hundreds and hundreds and hundreds of new memory cells. That's important because the day before they lost memory cells. But as you grow older, you release less and less of this brain-derived neurotrophic factor, so you're replacing fewer and fewer lost memory cells. So eventually there's a tipping point where you lost more memory cells than you're replacing, and eventually that affects your memory, when you're in your 50s, 60s, 70s. Turmeric, in 5 different human clinical trials, absolutely helps restore the release of brain-derived neurotrophic factor. So we know it's an anti-inflammatory in the brain. We know it's an antioxidant in the brain. We know it's healing in the brain. We know it's great for the memory. So I'm telling these people, I check the drugs they're on, and most of the time it's fine. And I say to them, add the biocurcumin 5-loxin. I would start with 2 capsules twice a day, 2 at breakfast, 2 at dinner, and see how it goes. It should really be of benefit. And tell your doctor. I also tell them to add Alcar with ALA. These are 2 nutrients. So the biocurcumin 5-loxin are actually herbs that have been used in human clinical trials that are good for the brain, although most of the studies are dealing with arthritis. But of course, arthritis is an inflammatory process, and it seems that the process that's damaging the brain in the long COVID people, the long haul people, has to do with inflammation also. Alcar with ALA are natural to the human body, but their function declines with age. And Alcar is actually a neurotransmitter in the brain involved with brain energy. It delivers energy from calories deep within the brain to the power plants within the brain cells. It's great for the brain mood. It's helpful with memory. It helps prevent the death of brain cells. It helps foster the release of other important neurotransmitters like GABA to calm the brain and for learning, glutamate for memory, glutamic acid for brain energy. I mean, it's a beautiful, beautiful supplement for the brain, for an aging brain. Because the enzyme involved with activating Alcar, carnitine palmitoyltransferase, declines in function in the brain with age, and giving Alcar with ALA, especially together, helps restore these functions. ALA does a bunch of things in the brain. It creates, out of sugar, it creates acetyl coenzyme A, and the brain uses that for fuel, and it's the Alcar that feeds it into the brain cell. But that acetyl coenzyme A is also a precursor to acetylcholine. And acetylcholine is your memory neurotransmitter. Acetylcholine helps repair your memory. Acetylcholine helps you solve problems. Acetylcholine lets you restore the creation of memory cells at night when you go to sleep. That whole thing with the brain-derived neurotrophic factor that we mentioned a couple of minutes ago. And the Alcar with the ALA work much better together, it's called a synergism, than giving them separately. Some things you add them together and there's no difference between 1 and 1. 1 and 1 equals 1. But many things have an additive effect. You add this together with that and you get twice the benefit. But with Alcar with ALA, it's a synergism. It's not like twice as good giving them together. It's like 10 times as good. So Alcar with ALA is great for mood. It's great for brain energy. It's helpful with memory. It's good for nerve health. I actually use it for people with nerve pain, peripheral neuropathy, whether it's from shingles, an outbreak of the varicella zoster virus, it used to be the chickenpox virus, or if it's from diabetes or they were on chemotherapy to treat cancer previously. I'll use the alcohol with ALA in people treated with powerful drugs for treating cancer who now have nerve pain to prevent the nerve pain from getting too bad. But in people with diabetic nerve pain or nerve pain related to a shingles outbreak, the alcohol with ALA is amazing what it could do for the nerve pain. So it's great for the brain, it's great for the nerves, it's very healing, it's good for energy, it's good for memory. So besides giving a bicurcumin 5-loxane, I recommend using alcohol with ALA. But there's 2 other things I recommend as far as supplements. I recommend tocotrienols. Tocotrienols is a fairly recently family of vitamin E, and you only need tiny amounts of tocotrienols in the brain for healing. And there was a study using tocotrienols. It was a study in people with white matter hyperintensities. I mentioned before that they're finding white matter hyperintensities in the brains of people with forgetfulness related to COVID, long haul effects. When they're checking the brain, they see damage to the white matter, and the damage to the white matter tends to grow and spread. When they used tocotrienols in 121 people with white matter hyperintensities over a 2-year period compared to placebo, the damage in the white matter did not grow and it did not spread. And when they went back a year later to take a closer look, they decided there was actually some healing related to the tocotrienols. So because of that, I'm also telling them to use a product called tocotrienol with pine bark for the white matter of the brain, and also lutein. Lutein is a pigment. It's a carotenoid. You know, when you look at a bird, like a pretty bird, the bird has red feathers. That's from a carotenoid called lycopene sometimes. They have yellow feathers from a carotenoid called zeaxanthin. And they have orange feathers from a pigment called lutein. It's a carotenoid. We know of about 900 carotenoids. Something like 90 of them are useful in humans. So you've heard of beta-carotene. They're kind of like cousins of beta-carotene, except they don't become vitamin A. Beta-carotene can become vitamin A. So lutein is very dominant in your brain and in your eyes. It's needed for fine vision. It's needed to protect your eyes. It's needed to protect your brain, and it's needed for memory functions. With age, you absorb less lutein from your food, and giving older people lutein is great for their brain. So I do recommend that these long-haul people, long COVID people, also add a lutein supplement to make sure they're getting sufficient levels. And then I tell them what to eat. Eat lots of berries. I mean, there was a report from the Mayo Clinic, must be 10 years ago, 20 years ago. They were calling blueberries brain berries. But they're not even the best berry for the brain. So I'm telling them eat a lot of berries, cassis berries, blackberries, black raspberries, blueberries. Those purple and blue pigments are really good for the brain. I'm telling them to drink organic green tea with lemon squeezed into it. Don't add milk to it. It seems to bind it up a little bit. But there are catechin polyphenols in green tea that are great for the brain. I tell them to consume a lot of green leafy vegetables. There's a whole bunch of things in green leafy vegetables that are good for the brain. Yes, you get some lutein, but you also get glutathione precursors, the mother of all antioxidants that helps protect the brain and other organs and systems throughout the body. You get vitamin D2, you get vitamin K1, getting a lot of things that are good for your brain in green leafy vegetables. Examples would be broccoli, spinach, bok choy, broccoli rabe, kale. I wouldn't include Brussels sprouts because I want people to eat these vegetables often, and Brussels sprouts can be tainted with heavy metals like arsenic, so it's not a great idea. Bok choy, I mean, there's a whole bunch of these green leafy vegetables. Even lettuce that you put in your salad is good for your brain. And lastly, lots of fatty fish such as salmon and cod and halibut, because fish oils are anti-inflammatory in the brain also. So thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts, or visit invitehealth.com/podcast. Please subscribe and please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. I hope to see you next time on another episode of the Invite Health Podcast, and thank you so much for listening.